in the background, that those are the mop-up operations, as RT explains to us there. On to this now. A study by the Competition Commission shows that its work had a significant impact during the COVID-19 pandemic. In its report, the impact of COVID-19 block expectations, or should I say block exemptions and commissions enforcement during the pandemic. That's the title of the study. The commission says the impact was felt particularly during the lockdown levels 4 and 5. For more on this, we're joined by James Hodge. He is the Competition Commission's chief economist. He talks to us from Pretoria. Mr. Hodge, thank you very much for your time. Firstly, let's start with the objectives of this study. What is it that you set out to achieve?
Well, we set out to achieve a sort of understanding of whether our enforcement actions had any positive benefits. So there were two main areas. The one was regulations to prevent price increases of essential products. And there, whilst the successful prosecutions are a matter of public record, what we sought to understand really was, through a survey of business users, is whether there was restraint shown by those that weren't investigated. In other words, whether the actions of the Commission articulated through the press, consumer activism, whether that meant that other retailers showed restraint and didn't increase prices and therefore had a broader positive benefit on keeping prices down during the initial lockdown and beyond. Yeah. And there, the survey results show that quite clearly there was high awareness, mainly thanks to the press, and that awareness meant that there was restraint shown. So it's an important finding because it shows that enforcement has a bigger deterrent effect, and that's the effect that we hope to see. The second area is really exemptions.
Mm-hmm. Yeah, please go on.
On exemptions, it's not as high profile. It's really allowing firms to cooperate and coordinate their response to the pandemic. Mm-hmm. And here we grant those exemptions, but it's really up to the businesses to make use of them. So it was a survey of those businesses just to find out how those exemptions were used and whether there was positive benefit. And certainly in areas like healthcare, there's required enormous cooperation. And you mentioned earlier just the vaccination program is an ongoing use of this exemption in order to ensure an efficient rollout. But through each wave, we haven't had a crisis really of shortages in hospitals because these hospitals and the pharmaceutical firms can coordinate on ensuring capacity, allocation of patients, movement of medical supplies and equipment to where it's needed.
Yeah. In the health sector, Mr. Hodge, talk to us about the kind of impact that you think the Competition Commission has made in spite of the widespread corruption that has been reported, particularly in the acquisition of PPE.
So the Commission initially focused its efforts on the retailers and wholesalers in terms of PPE equipment and prices, but also went up to suppliers. And many of those suppliers would also be supplying into healthcare sector. We have also expanded that program of enforcement to look at government procurement. So whilst there may be some instances of corruption, there's also cases of exploitation. So we share that responsibility with the SIU, where they may take instances of corruption forward and we may take instances of exploitation by suppliers. But I think overall the strong message is that this won't be tolerated. And we continue to enforce in this area. So we're still looking at tests. We're looking at pharmaceutical products that assist in this time, such as the flu jab. So there's an ongoing enforcement and presence, and I think that's important, again, for deterrent effect. This is a time when there is scope for people to exploit the situation, and the enforcement ensures that that doesn't happen.
Yeah, there will be criticism, though, in the retail sector. I know you've already mentioned it as part of your key focus. There will be criticism that you took too long in some instances to actually step in and intervene. And in the case of the ginger prices, for example, it was out of the outrage that played itself out on social media that the competition then sprung into action. Do you accept that criticism?
Look, I think there will always be those that feel an institution's too slow. The reality is that we need to mobilize consumers to identify a problem and identify where they're being exploited. So part of the success, at least in the first wave, was very quickly we mobilized consumers, and we were receiving up to 100 complaints a day. We reconstituted our investigative teams in order to do a rapid response. So we were investigating and referring to court within 3 weeks and prosecuting within 2 weeks thereafter. So in fact, the speed of response in the initial period was benefited from the consumer activism. I think we didn't quite see the same consumer activism in the second wave until things like Ginger got completely out of control. And then again, through the use of the press and our own enforcement actions, one's able to get the message out there, and suddenly consumer complaints come in, and that enables us to move in with force. So there's an important relationship, and we've said it all along, we need consumers to be active in this country. They need to help identify where things are going wrong, especially in outlying areas.
All right. So what happens then with the findings and recommendations of this study?
So the study is there to also help us learn. This pandemic is ongoing and it evolves, and there are different things that we face. So we may still need exemptions in the future in order to even respond to the recovery program. So what was useful from the survey was just to get feedback of those businesses that use these exemptions and also had to respond to price regulations, and just understand what worked and what didn't. So we can take those on board and refine these exemptions going forward. But I think the positive thing is that, it has been beneficial. There has been positive collaboration that has yielded very important results. And probably areas like healthcare is going to need ongoing collaboration as we ride out this pandemic.
Yeah, final question. Those companies that have found themselves on the wrong side of the law, how many cases would you say you are dealing with, and how many of those cases are actually being taken through the courts, if any?
Well, what's useful is that as soon as one has some success in the court with prosecutions, one generally sees settlements thereafter. So on the first wave, there were some 30 cases. 2 were taken to court, Diskem and a firm Babalegi, and even the Commission won that on appeal at the appeal court. But that meant that others settled because their conduct is of a similar nature. We've just done a few PPE cases before government procurement, before the Competition Tribunal. If those go away, then we should expect a large number of settlements on PPE as well.
All right. James Hodge, Chief Economist at the